Welcome back to the 2022 HIDA Prevention Summit. For those of you who may be joining us from the West Coast and maybe this is your first time logging on to the summit, we've had an incredible session already this morning. All of those sessions have been recorded and they will be available to you. So keep checking your email. We'll provide you all of those links and instructions on how to access them. I also wanted to mention that evaluations will be available in the chat box for all of the summits this morning in case the presentations this morning in case you missed them, and as well as all of the presentations this afternoon. So they will be entered at the conclusion of each session and you'll be able to access them at that time. We're also going to send them out via email, so don't worry about the evaluations. I know they are important to all of you. Quick reminder about the evals. If you are looking for continuing education credits, I strongly encourage you to complete those evaluations because those evals are attached to your certificate that you will be receiving in your email box as well to go ahead and file for any organizations you might need that for. All right, so today our topic has been focused on substance use prevention communications, and I'm going to just ground us again in our title, Mind the Message, Equipping Communities with Evidence-Informed Communication Strategies for Substance Use Prevention. And this is really focused on youth aged 12 to 18. And in our next session, we'll be introducing you to a toolkit that is designed to support you in bringing this evidence to life in your own way, right? But also while adhering and maintaining fidelity to, if you will, to the science base and what we do know works, the best available evidence that we do have, right, at this current time. All of that has been synthesized for you in the toolkit. We'll be introducing that in the next session. But in order for you to really appreciate the next session, we needed to lay a foundation with a concept called social norms. And I've invited two social norms experts here today to really talk you through that concept and help you understand what exactly social norms are and how they influence perceptions, behaviors related to substance use, the evidence so far that we have related to them. And I'll tell you that when the ADAPT team did our initial synthesis of the literature and reviewed that literature, this particular concept and approach is the one that had the most robust evidence for our purpose. And our purpose is to prevent onset or escalation of substance use in youth aged 12 to 13. So that is what we focused on with our literature review. You will hear all about our methodology and what we did to actually prepare the toolkit in the next session, but you need to understand social norms first because they really are threaded throughout the toolkit. So what I wanted to do now is just call your attention to a call to action that we issued this morning. And right now in your chat box, we are posting the link to that call to action. It is called Mind the Message, and really it's designed to support you, right, and to engage you and motivate you to truly integrate the best available evidence that we have for prevention communications with youth aged 12 to 18. So you can access that in your chat box, and I will be revisiting that with you a little bit later. We've got over 100 pledges so far, and our goal is 1,000. And so we'll talk about that in a little bit. But at this time, we're going to hear some introductions of our next speakers. Thank you.
My name is Amelin Malaf-Wersi, and I am the Public Health Analyst at the Puerto Rico U.S. Virgin Islands HIDA. I am pleased to announce our next set of presenters, Dr. Wesley Perkins and Michael Haynes, who will be talking today about the importance of social norms in substance use prevention messaging. Dr. Wesley Perkins is a professor of sociology at Hobart and William Smith Colleges and project director of Alcohol Education Project and the Youth Health and Safety Project, initiatives providing research, educational resources, and strategies to reduce risk-related and problem behaviors among youth and young adults throughout the US and internationally. Notably, Dr. Perkins developed the theory underlying the social norms approach to preventing risk behavior, which he will be speaking about today. He has worked extensively to develop the science behind the social norms approach and has guided hundreds of secondary schools, institutions of higher education, and community health agencies about social norm interventions throughout the United States, Canada, England, and Scotland. Michael Haynes is a private consultant and former director of the National Social Norms Resource Center. Mr. Haynes and his staff implemented the first successful use of the social norms approach to reduce heavy alcohol use, an effort that was chosen as an exemplary program by the U.S. Department of Education and a national model by the New York Times. Mr. Haynes has an extensive experience in applying the social norms approach to substance use prevention. Together, these presenters represent a wealth of expertise and experience in the evidence-based social norms approach, and we are immensely grateful to have them with us here today. On behalf of the Puerto Rico U.S. Virgin Islands HIDA, I would like to welcome Dr. Perkins and Michael Haynes.
Thank you. It's great to be here today, and I'll get started right away. I know our time is short. My task, as I understand it today, is to provide an overview of what this model, the social norms approach to substance use prevention, is all about, what are its basic principles, and then a little bit about the evidence that supports it. It's a lot to fit into just a few minutes here, so I'm going to be talking fairly quickly, but you have the resources, my slides and Michael Haynes' slides are available at the website. And so if there's something that I've gone too quickly about, you can just go extract the slides and take it from there as well. So let me get started right away. First of all, what I'm going to do here is talk about what it is, how does it differ from other approaches to substance abuse prevention among youth. Then what are the basic principles of the social norms approach? And finally, is there clear evidence of effectiveness in prevention interventions using this approach? So that's my agenda here, again, trying to fit that into a short period of time. But when we look at the current models of risk prevention, they contrast significantly with the social norms approach. First of all, the traditional health education strategy, which typically tries to provide information about how drugs affect the body, the pharmacological information, how they work, and the concerns around that, what might be the dangers and so forth. That traditional health education has not proved to be very effective at all. Largely, it's assuming that in providing that kind of information that the consumers of it, in this case youth, will be rational consumers and make decisions based on the information provided by that information. But that's not how most youth work. It's not how most humans work. We largely make our choices based on what other people are doing, what your friends are doing, what kind of shoes they bought, what movies they went to, what restaurants they go to, and so forth. And so that kind of rational choice, give them enough information and they'll make the right decision, as opposed to they're looking at what other people in their peer network are doing. That just doesn't really impact them very much, this health education. And health terrorism is even less effective. That is trying to scare the health into youth by all kinds of scare messages that tell them that the bad and awful things are going to happen to them if they use alcohol and other drugs, because basically what it's trying to do is scare them into saying, if don't do this or you're going to die, or don't do this or you're going to have a horrible consequence with it. When the reality is that most youth, even if they do try drugs, don't suffer that effect. It's not to say they aren't increasing their risks substantially by using a substance, but the model is based on a behaviorist notion that if people experience negative consequences, or at least if they see others experiencing negative consequences, they'll say, hey, I don't want to do that because I don't want to feel those consequences. But this is more like a situation where if an animal runs over a fence that's an invisible fence and shocks them, that they'll learn not to do that. Or if we see somebody being shocked by a fence that's to keep cattle in a pasture, we don't touch the fence either. But that's because that fence gives out a shock to any time that dog crosses it or we touch it and so forth. and it's very consistent. And that's what behavioral psychologists will tell you, that the negative consequences, if they're going to teach people not to do it, have to be very consistent and frequent and so forth. But but what we're finding is that most of the negative consequences that we talk about happen to a few, tragically. But it's like having an invisible fence turned on once or twice a year and thinking it's going to keep the cattle or the dogs in place. Then we can look at asset-based resistance strategies. Those have more promise to them. Building up assets in the community, building up assets in one's own abilities to resist peer pressure and these kinds of things. However, those strategies are very labor intensive in terms of training and working with youth, and typically can't reach broad numbers of youth at the same time. Also, some of these assets that are most significant in protecting youth are things that most prevention programs really can't deal with. And for example, having a strong religious faith-based identity may provide a protection. Having intact families, having economic resources in the household, living in a neighborhood that's very safe and so forth. Those kinds of things are things that we can't, as prevention workers, usually go in, certainly not when we're working with youth in schools and communities, and change. So then we move to social control, usually in the form of rules and regulations and laws and enforcement. That does make a difference. And if we eliminated them, certainly the problem rates would go higher. But we can't put all our eggs in the basket of trying to legislate our way out of the problem and think that creating rules and regulations just by themselves are going to reduce the problem, because most of the time, most of the violations in drug use and so forth are not going to be caught, or certainly are not caught today. And if we doubled our enforcement, we might catch 2% instead of 1% in the process. But again, sociologists look at this. There's so much more behavior going on than can be caught through policing. We need other things to help in the efforts to reduce substance abuse. And all these are focused on, all these strategies are focused on the individual and how we can create in them a fear or a strength to resist, but it ignores largely the peer base in the first place and the norms around the peer base. And so that brings up the social norms approach. Now, the social norms approach, the starting point is that humans are group oriented, and we are largely influenced and conform to peer norms, which is very different than those other strategies that I've been talking about. We're like these penguins on the ice back here. We're not like the lone bear on the woods, as we as humans engage in behavior. We look around and behave as others do. Many decades of experiments in psychology and social psychology have demonstrated you put a person in a room with others and they'll look around to see what other people are doing. And if you have an experiment where all the others are doing some strange act, standing up, sitting down, looking up, doing something, the person who is unknowingly the subject of the experiment will start doing the same behavior. We look around for guidance in terms of what's expected and what is normal and so forth. However, and there is this long tradition of theory and research on peer influence and conformity to peer norms. But what the social norms approach does is ask the question, what about perceptions of peer norms? We know that there is one of the indisputable findings in the research literature is that the peer norm is one of the strongest predictors of personal behavior. But we also know, and this is where the social norms approach cuts in, that peer norms about substance use and other risk behaviors are grossly misperceived in the direction of overestimated behavior and permissiveness in attitudes. I'm not saying here that the alcohol and other substance use problems among youth is not a big problem. Certainly it is a big problem, but it's not the norm in populations of youth. The majority of youth are not engaging in the behavior, the majority of youth hold positive attitudes. And that's the big unknown secret that is held back. And in holding that information back, we set aside one of the most powerful prevention strategies we can have in our arsenal of things to do. So, for example, we've conducted multiple surveys. This is just an intro survey screen from a survey with youth that we've conducted across the nation, or many schools across the nation. In fact, I'm showing you some data here from that's come from this survey, and it's anonymously collected data within the schools that we've surveyed, the students. 119 schools. Grade range was from 12 to 16. The data I'm showing you here is from 12 states where I had amalgamated the data in the end, because the results at every single school showed the same pattern. Little variation in percentages here or there from school to school, but the overarching pattern I'm going to show to you exists in every single school. And this is based on over 50,000 respondents. So here's what it looks like for grades 6 to 8 about tobacco use. 90% are not using tobacco, and this is over a range of schools, range of time, range of states. But again, the pattern is similar for all the schools. 90% never using tobacco. Now, when you ask the students what do you think is the norm? Is it to never use? Is it a couple times a year? Is it monthly? Is it weekly? Only about 35%, notice there's the percentages are different from the left and right graph. Only about 35% say that it's the norm, that no use is the norm in my school. In middle schools here, we're talking about. So only about a third get it right. And all the rest, which are the red bars, perceive that the majority of their peers in that school are using either a few times or monthly or even weekly. So we see there's dramatic amount of misperception. If we move up to the high school grades, we see that the pattern is on the left side that still 75% were not using tobacco. It declined a little bit or eroded from the 90% in the middle school, but overwhelmingly the majority were not using tobacco. But if we look over on the right side, we see that only 5% can accurately identify that it's the norm in their school not to use tobacco. 95% of students think that the majority of others, the majority of peers at their school are using tobacco, a wildly errant misperception. And if we look at alcohol, we see the same kinds of patterns. I'm going to go a little faster here on this one. But again, 75% not using alcohol. Oh, I'm sorry. I got to get this to change. Here we go. Tobacco, alcohol. Here we go. Is grades 6 to 8, not 75% not using alcohol, and about a little over a third get it right among their middle school about their middle school peers, but the majority are overwhelmingly misperceive again. If we move up to the high school grades, we see with alcohol use, it's there we go. With alcohol use in 6th grade, it's much higher. I'm backing up. It's 75%. It's now declined. About 43% never used, but among the many who have used, it's once or twice a year in a family occasion, maybe at the prom or something, once a year or so forth. And then the rest use monthly or weekly. But here we see on the right side that the perception is very small. Students can't imagine that never can be the norm at their school, and they think that overwhelmingly think that weekly use of alcohol is the norm among their peers. We've got much other research that demonstrates that same pattern, but we find it indeed this misperception is there in all types of schools. We find it across countries, size of schools, programs. No matter what the actual norm is in the school, they misperceive, they overestimate it dramatically, and this happens for all age levels. We see that it's across subpopulations of youth as well. It's not just whites or African Americans or Asian students or student athletes or males or females. The misperceptions exist in all these subcategories. They misperceive students overall, and they misperceive the subcategories as well. And it's there for attitudes about drugs. It's there about actual use of drugs. It's there about support for policies, and it's there when we look at protective behaviors, although it's the reverse. They underestimate protective behaviors, overestimate the problem behavior. And finally, it's there for all types of drugs. We find that consistently for all this pattern. So there are causes for this misperceptions and explanations of it. Quickly, there's this mental attribution process where humans make errors. They see somebody doing something maybe only once, and they tend to think, if they don't know the person well, they think they do it all the time. It's called the fundamental attribution error. So we tend to think that others out there are doing a lot more of this than is the case. It also is amplified by what we remember in our conversations. Vivid behavior, dramatic behavior, the sensationalized behavior, such as in drug use, is remembered more than all of the people who didn't use drugs last night or at the party over the weekend and so forth. And we talk about, and again, we talk about all of those who have used that are clear in our memory or sensationalized. And we don't talk about the vast majorities who are not using the drugs in our peer populations. And then the cultural level amplifies these misperceptions as well. Certainly the entertainment, media, advertising can hype the use of these alcohol, other drugs, and so forth. News events about problem behaviors among youth. If it bleeds, it leads in the news. And so we're reading all of that rather than getting information about what the majority does and thinks. And then health advocacy organizations also contribute to the problem, because they're often talking about the problem percentages of 25% of the youth are engaged in this or 10% are engaged in that. And so we tend to start focusing more and more on that, which amplifies our perception, because we don't remember necessarily that exact statistic and start thinking, oh, a lot do, oh, most do, everybody's doing it, becomes the perception. So if we look at the model, we tend to think that the actual norm is important in affecting peer behavior. And there's a lot of talk about, well, what's it like in your neighborhood, or watch out for what students are doing in your grade, or what about on your block or among your best friends and so forth. And we think of the actual norm as influencing personal behavior, but it ignores the elephant in the room, which is the perception of the peer norm. And that we've seen already, as I demonstrated with a little bit of data there, is that there's only a vague connection, a broken line, if you will, between the actual norm and what we think is the norm. But what we think is the norm is critical to influence how we behave, because we're trying to behave in accordance with norms, but we're misperceiving what the real norms are. So that has a much larger effect on our behavior. That is our perception of norms, which are usually erroneous. So the consequences of this is that it produces a reign of error, as I call it. The actual use and abuse increases based on these misperceptions. These layers of misperception compound. The opposition is discouraged from speaking out if I think nobody else agrees with me, or everybody else is doing it. Interventions by others decline. The bystanders are not going to intervene or say something because they don't think anybody else agrees with them that we shouldn't be doing this. And finally, many who are not engaged in behavior, they're carriers of the misperception anyway. They think most others are, and they add to the problem by talking about, I don't do this, but yeah, everybody else does. So it's a massive problem. So translating this into a prevention strategy from the social norms model is to say, let's identify what the actual norms are based on credible data. Let's intervene with intensive exposure to actual norms messages to provide less exaggerated misperceptions. Let's try to reduce, correct, or at least reduce the error in perceiving the norm. And the predicted result is going to be less harmful behavior, less risky behavior, with people having more accurate perceptions of their peers. So that's the model. It's simple and straightforward. The idea is that data about your peers is a healthy thing. I use the vitamin bottle analogy. We have it all in a bottle. We have that information, but we rarely share that side of the story with youth. And that's the good medicine that we have to get out there. So examples of strategies, we can do it in print media, we can do it in educational programs, in new student orientation presentations, in counseling interventions, in curriculum infusion, and in electronic multimedia, social media and digital signage, and so forth. Michael's going to talk a lot more about the interventions example side of this. Just show you a few poster examples from some of the projects. This is one from one of Michael's projects. I don't think he's showing you, but it's in DeKalb, Illinois, where they intervened with high school students in a smoking and alcohol project to reduce problem behavior. This is a project about tobacco in teens. The majority, 70% of them, do not use tobacco. This was done with the Most of Us campaign headed by Jeff Linkenbach, and I worked with them in this project and analyzing the data. Dogs sell, so this is an example of a message about this, but all these messages are about the positive majorities, not the problem rates in alcohol and substance use. Here's one from a small school, and it notes that it's based on 74 students, but this was actually a high school where there were only about 80 students in the high school. So we had a very high response rate, and all of them thought their peers were doing, most of their peers were engaging in the problem behavior, when overwhelmingly it was not the case, as you see in this poster. Again, in this poster, 86% say their parents never allow them to consume alcohol in their homes with friends, even if a parent is present. That's what they say about their parents, but they think all the other parents allow their children, or in other words, their friends, to engage in the risky behavior and use alcohol and so forth, which is a misperception. Again, they misperceive the strategies that their peers use actually to avoid drinking alcohol. And so we provide that information out there as well. On a larger scale, I analyzed data from the Pennsylvania Youth Survey in 2019. This is Delaware County in Pennsylvania. And they came up, they asked me, they said, can we in our area actually have positive norms? And I looked at their data and came up with numerous messages in a short period of time. I'll just give you some of the example. 4 out of 5 10th graders had not consumed any alcohol. Most 12th graders, 64%, had not consumed any alcohol. 95% of all those grades, the survey was based on 6th, 8th, 10th, and 12th graders, had not smoked cigarettes. 4 out of 5 10th graders and 7 out of 10 12th graders had not used e-cigarettes or vaping. The majority of 6th, 8th, 10th graders and 12th graders had not used marijuana. Again, this is all credible data-based messages. Some other examples: 98% of 10th graders, 99% of 10th graders, 98% of 12th graders had not used cocaine in their lifetime. 97% of 12th graders did not drink alcohol and drive last year. 4 out of 5 of all those grades believe it is wrong for someone in their age to use prescription drugs that are not prescribed to them. Overwhelmingly positive norms, but it's the best kept secret in Delaware County. Example of evidence of positive effects of interventions. I'm just going to give you a few here in a minute or two of time I think I've got left. Here, the study, we've got longitudinal studies, we've got experiments with intervention and quasi-control sites, and we even have a few experiments with randomly assigned intervention and control conditions for individuals or classrooms or even schools, although that's more difficult to get a study that large. So here's just a couple of examples. A lot of the research started with colleges and alcohol use because that's where the researchers were and a lot of the problem was at the time. My own institution, as well as 4 other institutions, in the first 2 years of introducing social norms campaigns, reduced their heavy alcohol use by 20%. And these are all different kinds of colleges and universities across the country, and all had the same dramatic effect. And a 6-year study at the University of Virginia showed, using an intensive social norms campaign, that each year they could reduce the alcohol problems further and further. The percent of students experiencing no consequences of alcohol use went up steadily, and experiencing multiple consequences went down steadily. Here's the tobacco intervention in Montana that I showed you a couple slides of. And we looked at the youth, a sample of the youth in the counties where the intervention took place, and looked at them 8 months later after the intervention. And these were youth who were not using tobacco. 8 months later, 10% of them had started using tobacco, which is not a good thing. But looking at the comparison or control counties, 17% had started using tobacco, and these were the counties that didn't have the intervention. So in essence, the social norms intervention cut the initiation rate almost in half. This is one of Michael's projects where they reduced the perception of students about the intoxication levels of their peers in media messaging. These are all statistically significant differences over the 2-year time period. They gave information to parents and teachers, reduced the parents and teachers' misperceptions across time as well. And in the end, with regard to student alcohol use, we see that consuming just alcohol at all in 30-day period went down over the 2-year period. Being drunk in the last 30 days went down. That's the purple columns. And the more reddish column is consuming 5+ drinks in one occasion. That went down significantly as well. Finally, I've got one example here. If my slides aren't moving at this point, I'm not sure. Let me see if I use this button. There we go. This is a study in Denmark, and Denmark has a very large alcohol problem, the biggest problem in the European nations with regard to their youth, and they have a 16-year age 16 drinking age law and so forth that also contributes to the problem. But here, this is a study of 1,355 students who were part of 38 schools that were randomly assigned to the program, intervention program or not, with social norms. And what happens with this is that in the intervention group, only half is likely to overestimate peers' lifetime binge drinking, and only 2/3 is likely to personally report 2 or more alcohol harms compared to those in the control group. And among permissive drinkers who thought they could drink even more, they were 1/3 less likely to binge drink frequently compared to their other drinkers. This slide is just what makes this approach the most effective: when there's clear positive message, when there's credible data, the absence of competing scare messages, when the dosage is high, when it's delivered with synergistic strategies, and you reach the broad student population and community to deliver the message. My time is up there, so I'll stop it right there. But essentially what we're trying to do with this, and the model is saying, tell the youth the truth, give them the accurate information, just give them the facts, and watch it work its healing message. Thank you.
I'm out of breath. Hi there, thank you for attending the session. I'm Michael Haynes, and I'll be going through my set of slides here, that some of which are similar to what Wes has been talking about. As Wes had stated, the social control approach, or the scare tactic approaches of traditional substance abuse education, focus on the problem and often exaggerate the statistics of the problem, so that when something increases from 2% to 4%, they talk about a 100% increase in use. The social norms approach, on the other hand, focuses on a solution, like health norms that are already resident within the population, and uses this is the same data that I showed in the previous slide, just turned around to where we're looking at how full the glass is as opposed to its emptiness. By highlighting these healthy norms, we're telling the truth about youth behavior in order to grow more of that behavior. That's the whole concept. By focusing on what they're doing right, exposing them to their own good behavior, we'll get more of that behavior relative to substance use. The social control approach, jumping about here, sorry, uses scare tactics, incredible messages. It tries to coerce healthy behavior for teen choices. And most importantly, it alienates teens. You as the messenger, using scare tactics, coercive messages that are unbelievable to young people, do nothing but alienate yourself from them. And that's not a good place to be if you're trying to communicate about substance abuse prevention. One of the nice things about the social norms approach, as far as I'm concerned, is it made me want to go to work in the morning, because rather than being a death educator, I'm somebody who is celebrating the good behavior that was already there in the teen population, but they, their parents, their teachers, their law enforcement authorities, and themselves were unaware of, because there was so much focus on the problem. The social norms approach inherently partners with the teens you're working with, because we're celebrating their good behavior. And that's a much more satisfying relationship to have when you come to work in the morning or whenever it happens to be. Every time you have data in front of you about teen substance behavior, you have the opportunity to tell a story. In fact, many of you in your professions are constantly telling stories about teen substance abuse, and you can choose what story you're going to tell. This is two stories being told using exactly the same data. They're both science-based. One is talking about how awful the problem is because 25% of teens are using alcohol or marijuana. The other one is celebrating the fact that 77% of the students don't use alcohol, marijuana, or other drugs. I ask every group of parents, teachers, law enforcement officials, and even teens which story they will tell and why will they tell it. The answer for why will you tell the first story is we're going to try to scare the health into them. The answer for why we would tell the second story is we're going to try to grow good behavior, grow even more of it that's already resident within the population. So the social norms approach, as far as I'm concerned, follows this formula. Our job is to identify the protective practices, healthy beliefs, safe behaviors that are the norms within a community or a group of students. And then we model and promote those behaviors. And we can model those behaviors with media, we can model those behaviors with our own behaviors. There's lots of ways to model, and promoting them just simply includes adding value and making very visible those healthy behaviors that are already resident within the community. Here are some examples of those. This is a high school in Illinois, a very large urban type high school. It's Evanston Township. It has over 3,000 students in it. You can see this is a far cry from this is your brain on drugs in terms of a message, strength in numbers, so on and so forth. This is Lake Travis High School in Texas, outside of Austin. Believe it or not, the Napoleon Dynamite image is still a very successful image to be used with media and teens. This is a make-believe school that I just put together, but it's real data from a real school. You get the idea here. What we're doing is exposing them over and over again to data about their behavior. This is Mandy. We asked the Long Beach students who in their school everybody loves, and it was Mandy, who works in the cafeteria line. So Miss Mandy agreed to wear a football uniform and be in our posters. And so we used a well-respected, well-loved messenger to carry our message about students' good behavior. This is Weston in Massachusetts. These are the top 10 reasons the students themselves gave for why they don't drink alcohol. And they're in order of most prevalent response to least prevalent response in the survey information. That's their mascot that's in the picture there. This is Wayland High School, also a suburb of Boston. They like Friends and the images from Friends, and so we use them in many of our pieces of media. We use a Stall Street Journal, the Stall Street Journal, which goes up in bathroom stalls over urinals. They're there because they can be packed with much more information because we have more time. We have a more captive audience than we do with just a poster or a message on a bulletin board or a billboard or what have you. And this is a combination of information that they want to see, like boxers or briefs, soft drinks, where you go on a romantic occasion or what have you, and messages that we want them to see, which is most of their peers typically don't drink. Stall Street journals are incredibly effective. They're liked by the student population in every school we've ever worked with, and we worked in over 50 or 60 different school systems around the country. This is a typical graph. This is real data from a school. It shows our pre-test before we provided any information. We asked them this question, and about 40% say they've seen our information even though we haven't put anything up yet. That's why you have a pre-test. After they're exposed to the information in posters or flyers or what have you, the numbers go up to well over 90% seeing the information. As they see the information over the same time period, their perception of drinking, in this case, goes down, and their subsequent behavior changes as well as their perception changes, just as the model predicts it will. That's lifetime, annual, and 30-day use, like you find in the Monitoring of Future study or the YRBS studies. Not only do we try to reach children with messages, but we try to reach parents as well, because we have this type of information from surveys. The left column in yellow are the frequencies over 50%, where the students say they sometimes or very frequently get information. The right-hand column, which may be more important, is how believable those sources are. And parents come in as the number 3 source and the number 1 source of credibility. Nurses, doctors, health professionals are the number 2 source of believability. The police officers and DARE are the number 3 sources of credibility. Your coach, poster at school, your teachers, all are credible sources. So what story you tell and why you tell it becomes a very important issue, because you are a credible messenger. Unfortunately, not only do students misperceive their 30-day use of alcohol or cigarettes or marijuana in this slide, but parents overestimate the student usage as well as teachers. So they are carriers of the misperception. In fact, parents and teachers can be part of the problem if they expose students to misperceived norms. Isn't it awful, everybody smoking marijuana? Anytime somebody says that, they are a carrier of the misperception. Here are some other methods that people have used besides posters or flyers. At Halloween time, they hand out, this is at a school in Illinois, they handed out candies that they stuck little labels on the back that had the social norm messages. This Maine Township High School. They had the teachers wear buttons that said, "Who knew 92%?" And then on the back, they had the script for the teachers. And the whole idea was to get the students to interact with the teachers and ask them, why are you wearing that button? What does it mean? So then the teacher would be the carrier of the positive norm message, because we know that the teachers are a credible source of information. These are messages, posters that were particularly designed to reach parents, to reduce parent provision of alcohol to minors. This is a ad that was in a local newspaper. It's addressing parents. It's telling them that they're credible sources of information, and it's providing them with some content to talk to children about. That was the project that Wes referred to earlier that occurred in DCP Safe. That's a front side of a postcard. This is the back side of the postcard. Again, it's scripting for parents what they could be saying to their children. Parents are very credible sources of information for 12 to 18-year-olds. So we're trying to address students themselves to change perceptions of behavior, and also trying to change the perceptions of parents, teachers, police officers, coaches, and counselors, so they become carrier of the truth about youth. Some final thoughts to consider. Anytime you hear problem, think solution. Anytime you hear somebody say what not to do, think of what you can tell them they can be doing, consistent with the messages or with the data. We're using credible messages, credible messengers, we're repeating the messages in many different ways, and we add value to the messages by normalizing it, describing a reward, and so on. So again, which story do you tell? Parents who host lose the most, another teen drinking party was raided, Mr. and Mrs. Haynes were arrested. Or are you going to tell, congratulations, parents, you set limits, you made the call, you talk safely to your teens? Every time you talk about drugs and children, drugs and teenagers, you're telling a story. You are credible. You need to tell the truth about their good behavior. Questions?
Thank you, Michael. Thank you, Wes. The Q&A has lit up. So what I've done is, and it's lit up with just really great questions, right? A lot of positive feedback on this approach and a lot of very interesting questions, many of which we have already addressed with you. And we have inserted some of the answers into the toolkit, so you can find them there. But I'm going to try to get to some of the most direct ones that have come up very frequently for everyone. The first one is this. While social norms projects work well for most substances, you just showed lots of outcomes related to alcohol, marijuana, other substances, but fentanyl is now one of our top priorities, right? How do you respond to fentanyl when one use can kill you? That's very different than alcohol or marijuana, the nature of that substance. So how would you address that from a social norms approach?
Well, first of all, we have to understand that with fentanyl use, as terrible and dangerous as it is, it's very, very low incidence behavior. When you have very low incidence behavior, like 2% of the population of 12 to 18-year-olds using ecstasy, it's hard to get a reduction in that number. But I would still identify behaviors that be consistent with non-use of fentanyl. I want to say that again. I would identify behaviors, the norms which are consistent with non-use. Why is it that most kids don't use fentanyl? Why is it that most kids have no interest in using fentanyl? I want to explore that with teens and expose other teens to those responses that I would get. I would mine the population for their good behavior. Most teens don't use fentanyl. The overwhelming number don't use fentanyl. Why? What do we know about that? We focus so much on why the small percentage do use that we miss the more important question, which is the norm of non-use and how students come by that norm. And that's something that I think we have to pay a lot of attention to in order to develop a norm intervention around fentanyl.
Okay, and then one just addition to that, we received a comment around, well, they may not be choosing fentanyl specifically as a substance. They may maybe be engaging in other substance use that may have or may be laced with fentanyl in some way. Would you apply a similar approach?
Yeah. Well,
Okay.
let me jump in and say there, I think that's suggesting the understandable worry about these drugs that can be lethal and in many instances are lethal and so forth. But it doesn't suggest that this model isn't applicable. I mean, even if we take the most problematic drug, which is alcohol in youth populations, most certainly, there are contexts in which it is lethal too, and the chances of it being lethal are high. if one's engaging in a drinking game, for example, or a drink 18 or 21 shots, or drinking and driving. Those are very lethal circumstances with the use of alcohol. But that doesn't mean that you can't address that problem with a social norms approach, because you can be delivering messages about the vast majority, with the large percentage of students never drink and drive, the large percentage of students that don't engage in drinking games. So the lethality of the drug doesn't mean that the model or the strategy is not applicable.
I might just add that an analogy might be suicide prevention, which also is fortunately rare but horrible with our population. And in suicide prevention work, with norm work that I've done, what we do is look for students who have felt desperate, suicidal, but did not follow through with their suicidal thoughts or intentions, to try to once again expose people to those solution-based approaches to addressing the prevention of suicide.
Okay.
And one example of that is giving messages out that most students support. I think it's good to seek out mental health assistance if they do have these thoughts or feelings. That it's stigmatized to seek out mental health, but we need to normalize the acceptance, the attitudinal norms that say it's okay to do this, because most people think, oh, nobody else supports that kind of behavior of seeking help. It's too weak, or too it's not, for boys it's not manly or something like that. We need to get the real norms out about how youth are supportive of peers who do seek help through mental health assistance programs.
Awesome. Thank you, Wes. Thank you, Michael. So the next question, and just for viewers to know, the next session is totally dedicated to the toolkit, which has in-length description of everything that Michael and Wes just explained. So if you didn't catch all of it, or if you're just now logging on, it is available in the toolkit as a starting point. But I also want to say, we have already agreed. I've talked with Michael and Wes to offer 2 post-summit webinars to help support you all in implementing this and in integrating and identifying some of the examples that you might be using, because it might not come extremely naturally, and you might have some of these nuanced questions that are popping up now in the work that you're doing. So we do have 2 post-summit support webinars that I'll be announcing in the final remarks. You can also just subscribe to ADAPT and you'll get those emails anyway. All right, the next big question, and we've only got 3 minutes left, but this is a big one. And even the youth that we consulted with on the toolkit did say this, right? They wanted to make sure in the examples that we were providing in the toolkit that there was no insinuation, right? Even like with this campaign called Most of Us, right? That there was no insinuation that their peers who may be using were being shamed in any type of way or alienated if they were in need of support and resources. And that has come up time and time again. They're very protective of their peers, regardless of the stage of use, and they were feeling that there was some type of comparison occurring, right? Or a shaming of some sort. Talk about that. How can you avoid kind of the us versus them, the shaming, while also using the strength of the social norms approach to get the outcomes that you're looking for?
Well, when I do that, I do a both and message if we have that concern, which would be to consistently apply the norm message that the overwhelming majority of our students are not daily users of alcohol, but for those who are, there is help, and they are supported by the overwhelming majority to access that help. And here's a number, or here's a site, or a reference to access that. I think that can satisfy both, that we have care and messages for those who may be the minority who are addicted or are in some other way involved with the substance, as well as continuing to identify the norm of non-use.
Wes, do you have anything to add to that?
Well, one of the things I would say is too, is that I think that in terms of messaging, the more that the message can focus on the simply just presenting the data, like this is just the news. We're not preaching at you. We're not
Right.
saying that okay, the 80% you're all good people and the rest of you who are bad people get on board. I mean, that what is really being said is this, because the critical factor is just reducing all of their misperceptions, those who are doing the right thing and those who aren't, to know that stop talking about and telling the story that everybody was hammered last night. You know, you don't, how many times do you hear a youth get up after a party and come downstairs the next morning and say, boy, I can't believe how many kids were sober or didn't drink last night. It sounds funny, it sounds ridiculous, but it's statistically true. So the more you can get them, just the message out as a news message without a lot of prescriptive language saying you should be doing this, I think at least it turns it away from that sense that we're shaming and alienating the other group.
Thank you for that response. Michael, Wes, thank you for laying this foundation for us and for teasing it out a little bit, helping us understand the theory behind it, and also giving us so many examples. That's really helpful. At this point in time, we're going to dive into that toolkit and give you even more examples and flesh out a variety of different things in combination with other frames and maybe ways of bringing social norms data to life using frames that have been identified as preferable by youth from the National Council of Mental Wellbeing. So we're going to log off here and we'll see you at the next session. Thanks to everyone.